Hi everyone, myself Dr. Shweta Patil. This is our YouTube channel SkillAyurveda. In this video, we will be seeing what is flash burns or a welder's flash or the arc's eye, or even it is also known as ultraviolet keratitis. We will be knowing what it is, how it is caused, and what are the preventive measures that can be taken to prevent the welding hazards with respect to the eye care. Then we will be knowing how it is treated and how it is prevented. Now let us see what is this welder's eye or welder's flashes. Here this is an inflammation, a painful inflammation of a transparent structure of the eye that covers the anterior segment of the eyeball, that is cornea. Additionally, even there will be formation of cataract too whenever the eyes are exposed for a longer duration for these ultraviolet radiations. The eyes may get even the cataract too. Now let us see what are the definite causes for this arc's eye. Here, whenever the eyes are exposed to bright ultraviolet radiations or even the infrared radiations, the cornea is susceptible to get the flash burns. Most of the times, the foremost commonest cause being the welding's arc or the welder's torch. These are popularly known as welder's flash or arc's eye. Here, apart from this welding torch, there are some other causes, like whenever we we expose our eyes to the bright sunlight, we view the sunlight directly, or whenever we are viewing the solar eclipse directly, or exposing to the photographer's flood lamps, halogen lamps, or the reflections of the sunlight of the surface of the water or the snow is the other causes for these welder's flash burns. Whenever the eyes are exposed to these ultraviolet radiations, usually both the eyes will be affected with these flash burns, and these flash burns are almost similar as that of the sunburns of the skin. Usually these will heal itself within 1 to 2 days without leaving any corneal scars. But sometimes whenever these inflamed areas of the cornea get infected, they will end up in the painful conditions like corneal ulcers, and these corneal ulcers may threaten the vision. We are discussing about the preventive measures along with how it is treated. Whenever the eyes are exposed to such bright UV radiations, either it may be UVA or UVB radiations, within 3 to 12 hours of time, the patient will start experiencing the signs and symptoms like there may be pain in the eye, there will be foreign body sensation in the eyes, the vision becomes blurry, and the eyes become bloodshot, they become very red, and there will be excessive watering in the eyes. And with these complaints, the person may approach the medical profession seeking the medical help. So, how these conditions are diagnosed is the medical professional will examine the eye in detail with a proper history. They will examine the eyelids, pupil, and the posterior segment of the eyeball for further damage of the eye with these flash burns. Then the vision will be recorded. The eyes will be numbed with the help of topical anesthetic agents, and then the eyes are examined under the slit lamp biomicroscope. Even the cornea will be stained sometimes to locate and to know the extent of corneal lesions. Once the condition is diagnosed as arc's eye or the welder's flashes, the treatment will be planned. Here I am discussing this treatment under two categories, that is the self-care before you reach the medical professionals, then next is the medical care. In self-care, what you can do is, if you are wearing contact lenses, those should be removed very immediately. Next, you can use the over-the-counter available artificial teardrops or the lubricants can be used to soothe the eyes. Then to prevent or reduce the pain intensity and the light sensitivity reduction purpose, you can use the dark goggles or sunglasses to soothe your eyes. Next, what will be prescribed by a medical professional is they will be prescribing some pain medicines, some topical antibiotic agents, and pupil dilating agents will be prescribed. And the use of topical anesthetic agents is restricted only to the diagnostic purpose. If these are used as a therapeutic purpose, they may slows down the healing process of the corneal lesions. Hence, those are used only once when the lesions are being diagnosed. And the patient will be called for follow-up visit approximately 24 hours to 48 hours within to see and to ensure a proper healing of the corneal lesions. Then, foremost thing to be discussed in this video is about the preventive protocol. This preventive protocol involves using of PPE, that is personal protective equipments and clothings, to prevent the welding hazards. It includes face and eye shields, like here using of helmets, face shields, then dark goggles. Wearing of dark goggles is a must. Why? Because these dark goggles or sunglasses will have this UV protective layer coating which will be helping to prevent the hazards created by this welding arc on the cornea or even up to the lens or retina. Then, apart from this eye care, this PPE will involve the respirators for lungs, then flame and fire resistant clothings for screen protection, and for noise reduction, the ear muffs or ear plugs can be accompanied with this PPE. And there are some boots and gloves which will be helpful while doing the weldings. Yes, to conclude, now we know these corneal lesions caused by these welders flashes will heal within 1 to 2 days without leaving any scar, but sometimes if they get infected, they may end up in the corneal ulcers leading to the vision problems. Hence, using of personal protective equipments is a must for welders professionals or those who are getting exposed to this bright UV or infrared radiations. Yes, this is all about the eye care in welding professionals. If you like our video, please press the like button, comment on our videos, subscribe to our channel SkillAyurveda. Thanks for watching.